Hello everyone, I am Anupam here and today we will be discussing how to determine the axis of a heart. By definition, the axis will mean the summation of all the depolarization vector that is produced by different cardiac myocytes. So what is the axis? It is sum of or resultant of depolarization vector produced by different cardiac myocytes, right? But clinically, if we see, the majority of the heart's work is done by the left ventricle, right? Because left ventricle is exposed to the systemic pressure which is very high. So approximately 80% of the work of the total heart is done by left ventricle. So the depolarization vector of the left ventricle will be called as the axis of a heart, right? Now, before going to actually decide what is the axis of the heart, we have to first discuss physics, right? So, if this is 2 point and in the second point the ECG lead is there, right? And from this point, an electric signal is going towards that point. So, what will happen to lead? That lead will show a positive deflection. Okay, it is coming towards it. However, if it goes against it, then what will happen to the lead? It will be predominantly negative deflection of the QRS component. This is the R wave of the left ventricle. If it is perpendicular, then what will happen to the lead? It will produce a equiphasic wave, right? Anything in between, for example, let's say we have a wave which is directed in this direction, then what will happen? Now it is coming, if the lead sees from here, it is coming towards it positive, but not 100% towards it. There is some component that is going away from it. So it will be predominantly positive, but there will be a negative deflection also. Similarly, if a wave goes this direction, what will happen to the lead? It is going away from it. So it will be negative deflection, but it's not 100% going away from it. There's some component which is coming towards it, right? So it will be predominantly negative, but there will be a little positive deflection also, right? So if this is the heart, and we have discussed in our previous class how the leads are placed. So lead 1 will be placed here in the left. Lead 2 and 3 looks heart from the below. Also lead AVF. Then we have AVL and AVR, right? So now the normal axis of heart by definition is minus 30 degree to plus 90 degree. So by definition, this is 0 degree, this is plus 90 degree, this is 180 degree, this is minus 90 degree. Right? This is normal axis. So what is the normal axis here? This will be minus 30 degree, this is plus 90. So this is the normal axis. Right. Now what is the left axis deviation? This will be minus 30 degree to minus 90 degree. This is any axis lies here is called left axis deviation. This is normal axis, right? Then we have right axis deviation, and that will be plus 90 to minus 180 degree. right? This is right axis deviation. Then we are left with called extreme axis deviation. Or north-west axis, that will be minus 180 to minus 90, and that will be this one. This is extreme axis deviation, right? So now we've seen the normal axis is minus 30 to plus 90. So this is the normal axis. Any axis lies in this location we will call normal axis. Then you have left axis deviation, that will be minus 30 to 90. This is left axis deviation. Then you have right axis, plus 90 to 180. This is right axis deviation. Then we have extreme axis, right? Now let us see how we can calculate the axis by using quadrant method. We will check only two leads, lead 1 and lead AVF. If lead 1 is positive, that means the cardiac axis lies to the right side of this vertical line. This is marked by the green lines. If AVF is positive, then the cardiac axis will lie below this transverse line. It is marked by purple lines, and their cross section is actually the axis of the heart, right? So it is 0, it is plus 90. As I've discussed, 0 and plus 90, this is the normal axis of the heart. Of course, the normal axis go beyond 0 to minus 30 degree, but if it is 0 to 90, it is normal axis, right? Now coming to the second picture, now the situation is lead 1 in the ECG, you see the QRS complex is predominantly negative. That means the vector lies, the axis lies to the left of this vertical line because it's negative, right? But then if AVF is positive, that means the axis lies below this horizontal line or transverse line, and their cross section is the axis of the heart. This is plus 90, this is minus 180. As you discuss, this is right axis deviation, right? Now the third scenario is a little bit different. Let us discuss. If the lead 1 is positive, that means the axis lies the right side of this vertical line. If AVF is negative, that means the axis lies above this transverse line, and their cross section is the axis. Now here is the interesting part. Because up to minus 30 is normal axis, then beyond this is up to minus 90 is left axis deviation. And because this axis is actually comprises from 0 to minus 90. So it can be, if 1 is positive, if is negative, it can be possible LAD, left axis deviation. Not 100% sure, because the axis can lie within minus 30 degree also, in which case it will be normal axis. So now how to differentiate between the possible LAD and LAD? That you can do by checking the lead 2. Checking the lead 2. And lead 2 is positioned in the left foot. From here, if lead 2 is positive, that means the cardiac axis lies below this line. Otherwise, if it is opposite to this line, it will be predominantly negative. Now because it lies below this line, the transection of the cross section of the 3 leads, which is this area, it is actually called the axis. Now because this area is 0 to minus 30, which is normal axis, so this is normal axis. From here you diagnose that it can be possible LAD, but lead 2 is also positive, that means it's a normal axis. However, if lead 2 is negative, then this is the cross section. This is minus 30 to minus 90, and this will be called as left axis deviation, confirmed, right? Here it is possible LAD, next check lead 2, then we will get whether it is normal axis or pure left axis deviation. In this way, by checking lead 1 AVF, we can diagnose whether it is a normal axis or a right axis deviation or a left axis deviation. In possible left axis deviation, you have to check the lead 2. If it is positive, then it is normal axis. It is negative, then it is left axis deviation. So in this, you will diagnose the axis of heart. Thank you very much.